I've been very keenly interested in the neuroscience of pain for the past couple of years, and once I started rolling with it, I've just bought more books, taken a course. It just kept really rolling with the power of the mind. So when I talk about pain with my patients, I talk about examining them and taking a full assessment and imaging if required, and looking at a cause, but also where it's processed. Because when I say my pain is processed in my brain, I'm not dismissing my pain or saying it's all in my head. I'm saying that everybody's pain is processed in their brain, and there is an absolute overwhelming wealth of evidence that shows that we can modulate and change what we perceive in regards to pain. And a simple little thing is to say, listen, if I told you Fluffy, whether that's a cat, a dog, a gerbil, I don't care. If I said Fluffy had been hit by a car, your heart would start, I've got a message, your heart would start thumping. You'd start to sweat a little bit. You'd start thinking faster, where's Fluffy? How can I get to Fluffy? Get Fluffy to the vet, things like that. You're breathing faster. If you breathe fast enough, you can actually change the pH in your blood, and you can get tingly, numb, things like that. You can sort of really start getting sweaty and nervous. Now, I tell you that Fluffy's fine. So this was just a thought. And we were able to change our heart rate, get ourselves sweating, breathe faster, change the sensations in our body, just with one thought. Pain is protective. It's a harm alarm. But just like any alarm, it can get a misrepresentation. It can make a mistake. Or like that horrible smoke alarm that you get that sometimes just goes off all the time when nothing's going on. So if you can move yourself into a position where you're ramping up your pain, you know you can change the way you think to bring it down. And I've been into, as I said, a bunch of books, a course on the modulation of chronic pain. I use it in my life. I use it with every person that comes in and talks to me about an experience of pain. And I am only too happy to talk with you about it because it's powerful stuff. If it were a pill, the pharmaceutical companies would be all over this. But because someone isn't making mega bucks to start marketing it everywhere, it's not on every shelf. I want to see it on every shelf.